Doctor, why is vitamin C an important nutrient to help increase resistance to prevent COVID-19?
Supplementing with vitamin C is necessary to protect health, increase metabolism, and strengthen the resistance barrier, and thereby supporting the enhancement of the immune system. And according to the study, vitamin C and resistant function published in the U.S. National Library of Medicine, vitamin C contributes to immune defense by supporting various cellular function of both the innate and adaptive fluid immune system. Vitamin C accumulates in phagocytic cells such as neutrophils, which introduce a reactive oxygen species and ultimately destroy a microorganism. And this study also showed that vitamin C deficiencies lead to impaired immunity and increased susceptibility to infection. And furthermore, vitamin C supplementation can prevent and treat respiratory and systemic infection. And a high-dose intravenous vitamin C supplementation can help improve lung function and help reduce morbidity and limit the risks requiring mechanical ventilation.
What evidence shows that vitamin C effectively increases resistance for people infected with COVID-19?
Well, SARS-CoV-2 is a new virus that has been around since 2019, and several studies of infection across a variety of conditions have shown vitamin C to be beneficial in certain groups of people, especially patients with COVID-19. Currently, there are at least 2 trials underway specifically using vitamin C to treat 2 coronavirus patients with severe symptoms, one in New York and one in China. And to date, the effects of vitamin C supplementation have been reported, including one is the elderly people with acute respiratory infections. Second is acute respiratory distress syndrome. Third is reduce the severity and duration of the common cold. Fourth is reducing length of hospital stay and symptoms in elderly patients with pneumonia. And the last is that it can reduce mechanical ventilation time of patients treated in ICU.
So doctor, how much vitamin C is enough?
According to research by nutritionists, the maximum limit of vitamin C that a body can accept is 2,000 mg of vitamin C for people over 19 years old. The same applies to pregnant and lactating women. So, if you accept this limit, you will be considered too much with vitamin C. Specific daily vitamin C limits for infants and specific infants. The children from 1 to 3 years old is about 400 mg. Children 4 to 8 years old is about 650 mg. Children from 9 to 13 years old is about 1,200 mg. And for teenagers from 14 years old to 18 years old is about 118 mg. When we have an infection or inflammation, there are many factors that reduce the absorption of vitamin C in the body, and as a result, the required intake of vitamin C will increase to cope with this deficiency. There are also limited doses of vitamin C for specific exceptions. However, the exception limit dose is usually applied only with the consent of medical professionals.
If taking too much vitamin C, will it cause any harm to the body, doctor?
when a person takes more than the limit of vitamin C that the body needs. Symptoms such as digestive disorder, stomach ulcer, cystitis, increased kidney stone formation, gout, and decreased blood sugar levels will occur. Requirement interfere with absorption of vitamin A and B12. Do not arbitrarily supplement vitamin C by mouth, especially high-dose vitamin C without a doctor's prescription. Taking too much vitamin C by mouth can cause side effects, and in particular, pregnant women take high dose of vitamin C for a long time may cause an abnormal demand in the fetus.
So doctor, can you tell which foods are rich in vitamin C?
Citrus fruits. Vitamin C get a boost from most people after they catch a cold. That's because they have built the immune system, increase the body resistance. Common citrus fruit are orange, tangerines, grapefruits, or lemons. Second is red bell pepper. Red bell peppers contain twice as much vitamins as citrus. They're also a rich source of beta-carotene. Besides increased resistance, beta-carotene help keep your eyes and skin healthy. Third, you can eat broccoli. Broccoli is also a very rich vitamin C group. Food, yes. Fourth is papaya. There is about 224% of daily essential vitamin C in just one papaya. Yes, papaya contains a digestive enzyme called papain that has anti-inflammatory effects. Last you can eat is kiwi. Like papaya, kiwi is full of essential nutrients including folate, potassium, vitamin K, vitamin C. Vitamin C helps strengthen white blood cells to fight infection. It can be said that providing enough vitamin C for the body during the current epidemic is extremely necessary to protect yourself and your family from the current epidemic spreading at a dizzying rate. Vitamin C cannot be stored or made in the body, so it needs to be taken on a regular daily basis.